So as our offices begin doing this, the first day that they start, patient-centered communication, what are some tips and tricks that they can begin working with?
Yeah, that's a great question. And I think we'll see a lot of different things in these coming videos. But I would say maybe first would simply be asking permission. Can I share some information with you? Can I lean you back? It tends to give the patient a lot of voice in the appointment, and can be really powerful as we work towards helping them feel empowered in these situations. So let's take a look at what that actually looks like. So Shannon, we'll take a look in your mouth now, and if it's okay with you, I'll lean you back and we can take a peek. How's that sound?
Okay, sounds good.
Good. So the second thing that I might recommend is asking engaging questions, especially at the beginning, especially with new patients. I call this kind of like finding the North Star, right? So I'll often ask a patient, what are your goals for your teeth? And I've never had a patient say to me, I want my teeth to hurt. I want them to look bad, right? Everyone says, I want healthy teeth. I want to keep them forever, right? And that allows me to then come back and say, cool, so what are you doing that's helping you do that? Or asking questions like that. So asking engaging questions about goals, desires, hopes for teeth can be really, really helpful. So let's take a look at how that looks in action. How are you doing?
Good, how are you?
Good. I'm Dr. Allen. I'm one of the dentists here.
Nice to meet you.
Nice to meet you as well. I'll be taking care of you today if that's okay with you.
Sure.
Today and from now on, hopefully.
Okay, great.
Awesome. So what I'd love to do first is just kind of talk about what we might do today, kind of give us a sense of the appointment and the agenda. So usually what we start by doing is just talking a little bit, getting a sense of who you are, finding out what your goals for your teeth are. From there, we'll take a look at your x-rays, take a look in your mouth, and at the end, we'll kind of try to work together to help create a treatment plan according to your values and preferences. So how does that sound to you?
That sounds good. Thank you.
Cool. Yeah, no problem. But one of the first things that I love to do that I think is really important is to help us both understand, when you think about your teeth long-term and big picture, what would you say your goals for your teeth are?
My dad had dentures, and I know that he was always really miserable with them. And so I would love to just keep my original teeth for the rest of my life.
Yeah. So just keeping your teeth healthy, making sure that they're there long into your life.
Yes.
Perfect. That sounds great. Third, dental offices are really great right now at implementing caries risk assessments or becoming better at it. But it tends to be really disengaging when they do it as a strict 13 yes or no questions, right?
Very long forms.
Yeah, that's really disengaging, right? No one wants to sit there and be asked, hey, do you do this? Do you do this? Do you do this? That doesn't feel like a conversation. You're not going to go have coffee with a friend and have that happen. So can we take those questions and make them a little bit more open so that it feels more like a conversation?
Add the human element to it.
Exactly. What is a way that you could say, hey, what are some things that you do that help you keep your teeth healthy? Could we learn enough about their oral hygiene from that question to help us answer the questions on the caries risk assessment? Let's take a look at that.
Very good.
All right, Shannon. So I have just a couple questions for you in terms of maybe helping us find out what your risk is for getting cavities. That can kind of help us understand what you might be able to do at home to help you avoid those cavities in the future, keep those teeth for the long term like you want to, and maybe some things that we could maybe do for you here in the office that help you achieve that goal too. So how's that sound?
Great.
Cool. The first question I have is pretty simple. It's just simply, what are you doing at home to help keep your teeth healthy?
Well, I brush in the morning and then before I go to bed, and I floss occasionally whenever I think about it.
Okay, so you're brushing, getting that toothpaste in there, yeah, and then you floss sometimes when you think about it.
Yep, exactly.
Okay, cool. And lastly, we've done a really good job historically about telling patients what their goals should be, and we know it's much more helpful, and patients are much more effective when they're the ones who are choosing their goals. There are certainly ways that we can do that by saying, hey, what do you think you could do to help you keep your teeth healthy? And we can use different menus, things that have healthy choices on them, things like that are going to allow patients to be the ones saying, I'm interested in this. This is what I think I could do. And again, the evidence shows that patients are more likely to succeed when they're the ones choosing their goals instead of us saying, hey, you really need to do this.
Makes them feel part of the process.
Exactly. Totally empowers them, makes them feel like, wow, this is something that I want to do and can do. And we can support them in that.
Very good.
Let's take a look at that. All right, Shannon. So it sounds like you really want to keep your teeth healthy. It sounds like you're doing some really good things at home already. It sounds like you're also willing to maybe do more to kind of help avoid those cavities in the future. This is a little sheet here that we have that things that other people have found that are helpful in terms of things that they like could do at home. I wonder, looking at this sheet, if there's anything that you feel like, wow, yeah, I could definitely do that, or that's something I would like to do to help keep my teeth healthy.
Yeah, I think, if I could just do the different or stronger, better toothpaste, that would work.
Okay. So right now your toothpaste, it sounds like, has fluoride in it, but if it was just a stronger toothpaste, you might be...
As long as it's just switching it out and not adding a step.
Okay. Yeah. So no, you don't want more, you just want stronger.
Exactly.
Okay. Yeah, that sounds great. Well, we'd be happy to talk with you at the front desk and maybe help you get some of that stronger toothpaste.
Okay.
So that you could use that at home, and it would be the same steps. And we could even talk to you about maybe how to use it so that it's the most effective.
Okay, perfect.
Great.